I am Dr. A.K. Dhar. I am Director of Medical Oncology and Bone Marrow Transplant at Fortis Memorial Research Institute, Gurgaon. I have been working in this hospital for almost 3 years, and my area of specialty is bone marrow transplantation. Let us understand what is bone marrow transplant. Bone marrow transplant is a specific process by which we change the bone marrow of a deceased person, particularly for patients of cancer and other diseases where treatment with normal modalities of treatment is not possible. It involves changing or infusion of bone marrow cells from a donor into the deceased person. This modality of treatment has become popular in last 2 to 3 decades. There are certain myths about and certain understandings we need to know about bone marrow transplantation. First is that people believe that it is a organ transplantation, but contrary to that, it is not an organ transplantation because neither the organ is removed nor the organ is accepted by the patient. Bone marrow transplantation is basically the source of graft is particularly from a donor, and while we remove the graft, there is no damage to the patient and donor recovery is 100%. Now there are questions being asked about the types of bone marrow transplantation. The types of bone marrow transplantation are autologous transplantation, allogenic transplantation, and unrelated matched donor transplantation, and recently haploidentical transplantation has come into existence. Now the question is that if the patient has to undergo allogenic transplantation, we have to understand what are the chances of having HLA matched donor among the siblings. There are only 25% chance that siblings will match with the patient. So the choice of graft depends upon availability of the donor. Is there any age limit for bone marrow transplantation? There is no as such bone marrow age limit for bone marrow transplantation, but bone marrow transplant is successful in patients who are less than 65 years of age. A very important question is that for a successful transplantation, what we should have? We should have trained staff, dedicated members, we should have teamwork and a good functional transplant unit. The transplant has come into existence in last 3 decades, and we have got very few centers in India in last 3 decades. About 25 to 30 centers exist in our country, but we require more than that centers in our country. So the number of transplant centers in our country is inadequate. What are the cancers which can be cured by bone marrow transplantation? The cancers very commonly we treat by bone marrow transplant are leukemias, lymphomas, thalassemias, sickle cell disease, and sometimes breast cancer and ovarian cancer. So this means both malignant and benign disorders are being treated by this modality of treatment. Now the issue is the availability of donor, particularly for allogenic transplant. We are able to find 1 donor in 4 patients for successful transplant. In rest of the 75% patients, we have to depend on unrelated bone marrow transplantation. And this unrelated matched bone marrow transplantation is done through International Bone Marrow Registry, where we send the HLA typing of the patient, and this HLA typing is matched with the patient's HLA type, and if the HLA type matched donor is available, the stem cells from that particular donor is extracted and sent to that particular center where transplant is to be taken out. Recently, we had a Russian patient who was a case of acute lymphoblastic leukemia, and in that particular patient, the donor was not available because he was a single sibling. It was an emergency, so we searched the donor for that particular individual and found that the donor was available in Poland. We contacted the bone marrow registry people and they called the patient. They extracted the stem cells after fully investigating donor and his feasibility or fitness for transplantation. The stem cells were taken out and they were packed in a required temperature, and this was brought to our hospital by a courier, and these stem cells were administered to the patient, and this patient acceptance to these stem cells was good. Patient tolerated this procedure very well, and subsequently he grafted by these stem cells, and it was a successful unrelated matched donor transplant as far as allogeneic transplant was concerned. Thank you very much.